I am Shanna. I am a Canadian ENT resident. I am trying to film a day in the life. I normally do advice videos for med students and pre-meds on my YouTube channel. I am on an ICU rotation right now. This is from a local artist here in Calgary. This is just so relatable about residency. Alright, it's 6:30, so I'm just heading down to the parking lot to start driving to the hospital. I would actually consider ICU a late start compared to surgery, which is nice. We have definitely started at 5:45, more often 6 in surgery. So 7 o'clock start is pretty nice. It's noon. We just finished rounding on all the patients in the ICU. Unfortunately, I left my lunch on the table, so I'm gonna have to go buy some and head to the doc's lounge, see if I can catch the ophthalmolastics resident who's also on call, and see if we can hang out for 30 minutes before I have second rounds at 1 p.m. I'm just gonna enjoy this burger and fries. This is what our doc's lounge looks like. So Emma did come and we hung out for a bit while doing our foundations of surgery modules, which I clicked through, finished one on post-operative fever, but after about like 15 minutes or so, and then her attending came and she had to like review, and then I had to go to go back to do some rounds again at 1 p.m. But I did collect some. Our call room looks like, so there's one of these beds. If it's in the winter, I recommend usually I get 2 or 3 extra blankets to stay warm. It's quite chilly, at least here in Calgary. And they always have a computer and a phone here, which is super useful. Pro tip though, if you're in Calgary, make sure you always check that you don't use one of these 77 numbers, because if you're out of hospital, you can't call, like if I get a consult from you, I can't call back to it. You have to get one that starts with a 3 or a 4 or a 5, depending on which hospital you are in, so don't use a 77 number. An Anki deck that I got off Reddit is not working. Its images are not synced, so I think I'm just gonna download, like get rid of the deck, download it again, or find another new deck. Anki deck is loading, as you can see here. I'm just gonna work on this surgery curriculum, so it gives you a case. I wanna know if he's ever had surgery. Went back down to the ICU, gave family some updates on imaging results, how patients are doing, so they stay in the loop. I just sent off a research proposal to my supervisors, and then I'm going to hack through more of the surgical modules. I have an hour to go before we do evening rounds with the ICU outreach doc, so. It's 9 p.m. I'm back in the room again. I just finished tuck-in rounds over back at the ICU just to meet with the incoming charge nurse and just check on all the issues and all the patients, just make sure everybody's okay for the rest of the night for all intents and purposes. So far you've seen me just round 4 times in a day in the ICU. I'll show you. We carry 2 pagers in the ICU. This is your regular, every resident has their own pager. You just take with you to every rotation. This one is a pager for just codes. So code 66s and code blues, and ICU residents are supposed to go and help. Well, you're supposed to go run the code. I am very intimidated to do so. Haven't done one yet. Yeah, knock on wood. I mean, we're very trained. We train a lot to be able to do so. It's just that I'm scared to do it in real life. But you have lots of support, and then a whole team who does this like all the time, and so you're not actually going to mess up. But I think it's good to keep a huge slice of a humble pie on you at all times. So I'm gonna try to get some sleep, because I'm sure there'll be different consults and things that come in over the course of the night. So So at 3 a.m. I went to a cold blue, did that, tried to put in a central line, tried to put in an art line, and then saw consult in the emerge, and now it is like almost 8 o'clock. So finally I am done. The new resident for ICU has come on, so I'm gonna go home and I'm gonna sleep. And that is the end of 24 hours on ICU call shift. What a situation we have here.